This is the April 2024 TouchWorks education. We have a few orders to share. The FQHC prenatal patient tracking order, the SIU only GI open access colonoscopy scheduling order. This is to be utilized for colonoscopies that meet certain criteria. Reordering the questions in the order. We added a new question, date of last colonoscopy. When searching the patient's chart, look for the colonoscopy or operative report. This was also a Tuesday TouchWorks tip that was sent out on 3/26 of 24. SIU only pelvic floor therapy evaluation and treat. SIU OBG will use when referring outside of SIU for pelvic floor therapy. And SIU Urogyne will use when referring to Pelvic Wellness Center for further treatment. Financial auth and appointment statuses are both required. The PTH intact only -SMH has been updated to the PTH intact only -SMH and DMH. CT cardiac calcium score has been updated to financial auth not needed. There's been some order updates. The Lysholm knee score has been updated with result items with a pick list for each item. Mammography and bone density orders have been updated with new phone number for the DMH scheduling department. SIU only open access colonoscopy order. Questions have been added and order updated. The SIU only speech therapy evaluation and treat is set to financial needed and appointment needed. It will auto resolve ongoing active. Urine protein creatinine ratio order has been updated to remove the default performing location of MMC lab. The SIU only quit line referral. The order instructions were moved to patient instructions and new questions with pick list were added. Is the patient pregnant, which is a bright yellow field, and the best time to call. Inactive orders. The below orders have been inactivated under the supply tab. Please use the walker order that's specific walker information inside the order. Flowsheet updates. The SIU ortho flowsheet has been added. The results from the Lysholm knee score will be added to the flowsheet. Basic chart order updates. Initial evaluation and discharge notes from physical therapy will now flow to TouchWorks as outpatient PT notes in the rehab therapy section. A task will be generated to the ordering provider. Info tab updates. The MPS info has been updated to MH info. Immunization updates. The Arexvy 120 micrograms, 0.5 milliliters, intermuscular suspension reconstituted will now auto charge 90679 upon completion. Medication updates. The candidate Abacan's allergy extract solution. We have now added the Greer Laboratory Inc. as a manufacturer option in the dropdown. Phone and fax number updates. SIU Maternal Fetal Medicine has updated their fax number, and this has been changed on all of their letterheads. SIU GI POEM scheduling form updates. The CPT codes have been corrected from the 43239 90135 to 43239 to 91035. Code additions and updates. 9002 has been added, 90679 has been added, and J9196 has been added. If you have any questions in regards to any of the education material that you have just seen, please reach out to your CI nurse for assistance.